Let me ask you something. What if you could get a tiny, instant peek at how well your blood is flowing to your hands and feet, using nothing but your own 2 fingers in about 10 seconds? No machine, no needle, no appointment. Just a gentle press on your fingernail and a look at how quickly the color returns. It sounds almost too simple to mean anything, but this little check is genuinely used by doctors and nurses. It even has a name, the capillary refill test, and it offers a quick, gentle glimpse at your circulation, the flow of blood through the smallest vessels in your body. So today, I'm asking 3 questions. 1. What is this fingernail test and how do you do it properly? 2. What is it really telling you about your blood flow? And 3, and this part is so important, what does your result actually mean and how can you support healthy circulation? Now, 2 things up front, and please take these to heart. First, this is general awareness, not a medical diagnosis. It's a fun, useful snapshot, never a verdict. And second, as you'll see, this test is easily thrown off by simple things like cold hands, so we have to do it the right way to learn anything at all. So warm up your hands and let's investigate. First, let's understand the big idea, because it's genuinely fascinating. Your blood doesn't just flow through the big, obvious vessels. It travels all the way out to the tiniest ones, called capillaries, the delicate little channels that feed the very tips of your fingers and toes. These are the far edges of your circulation, the end of the road for your blood supply. And here's the clever part. When you press firmly on your fingernail, you squeeze the blood out of those tiny capillaries underneath, and the nail turns pale or white. Then, when you let go, blood rushes back in, and the pink color returns. How quickly that color floods back is a little clue about how briskly your blood is moving through those smallest vessels. It's like tapping the very end of a garden hose to check that water's still flowing all the way to the tip. A simple, elegant peek at your circulation. So let's learn to do it the right way. So what exactly is this test? It's beautifully simple. You press on your fingernail until it turns pale, then you release, and watch how fast the normal pink color comes back. That return of color is called capillary refill. Doctors even time it in seconds. That's the whole idea. But before you try it, this next part matters enormously, because if you do it wrong, your result means nothing, and you might worry yourself for no reason at all. So let's do it properly. Here's how to set yourself up for an honest result. Please don't skip this, because these details are everything with this test. First, and most important, warm up your hands. This is the big one. Cold hands are the #1 reason this test gives a false, slow result. When your hands are cold, your body naturally tightens the vessels in them to conserve heat, so the color returns slowly, and that's completely normal, not a circulation problem. So rub your hands together, run them under warm water, and make sure you're in a warm room. Never judge this test with cold hands. Second, remove any nail polish, since it hides the color you're trying to see. Third, do it in good light so you can clearly watch the color change. And fourth, remember this is just for gentle awareness. It is not a diagnosis, and one slow result on its own means very little. With all that set, here's the test. All right, here's the test itself. Rest your hand at about the level of your heart. Take the thumb and finger of your other hand and firmly pinch the nail of one finger, the fingernail bed, pressing until it turns pale or white. Hold that gentle, firm pressure for about 5 seconds. Now release and immediately watch the nail. Count slowly, 1,000, 2, 1,000, and notice how long it takes for the normal pink color to flood back in. That's it. Press, release, watch the color return. You can try it on a few fingers and even on both hands to compare. While you're at it, take a calm look at the resting color of your nail beds too. A healthy pink is a reassuring everyday sign. Once you've gently tried it, let's talk about what it's actually showing you. So what does this simple color change reveal? A few meaningful things. First and foremost, it's a quick window into your peripheral circulation, how well blood is reaching the far edges of your body, your fingers and toes. A brisk return of color suggests blood is flowing nicely out to those tiny vessels. Second, the resting color of your nails offers gentle clues too. Healthy nail beds are pink. Very pale or white nail beds can sometimes reflect low circulation or low iron. And a bluish or purplish tint can suggest the blood isn't carrying enough oxygen, something worth mentioning to a doctor. And third, taken together with how your hands and feet feel, warm or cold, normal or numb, this gives you a small, everyday sense of how your circulation is doing. Now, before you read too much into any of it, we have to talk honestly about what a normal result actually is, because this is where most people get it wrong. Here's how to make sense of your result. And please, let's keep this calm and honest, because the numbers surprise people. In healthy younger adults, the color usually returns within about 2 seconds. But, and this is so important, that number is not the same for everyone. As we age, our circulation naturally changes, and a normal, healthy older adult can take considerably longer. In fact, research shows that in older adults, a refill time of up to around 4.5 seconds can still be perfectly normal. So if you're over 60 and your color took 3 or 4 seconds to return, please do not panic. That may be completely normal for you. And remember temperature. Studies have found that in a cool room, the very same healthy person can go from a refill under 1 second to nearly 3 seconds, purely because of the cold. Nothing wrong with their circulation at all, just cool hands. This is exactly why doctors treat this test as one small clue, never a diagnosis on its own. Its reliability is genuinely limited, and it's always read alongside other signs. So here's how to hold your result wisely. If your hands were warm and the color returned reasonably promptly, that's a lovely, reassuring little sign. If it was slow, don't leap to alarm. Warm your hands and try again, and simply take note if it's consistently slow along with other symptoms. It's a nudge to pay attention, never a sentence. And the truly good news is that supporting healthy circulation is very much in your hands. Here's the encouraging part. Whatever your result, the things that support good circulation are simple, powerful, and available to almost everyone. Move your body. Circulation loves movement. It's what keeps blood pumping out to your fingers and toes. Regular walking, gentle stretching, and simply not sitting still for hours all keep the blood flowing. If you've been sitting a while, get up, walk around, wiggle your fingers and toes. Keep warm. Warm hands and feet mean open, relaxed vessels and better flow. So cozy socks and gloves in cold weather genuinely help. Stay hydrated, since your blood needs enough fluid to flow well. Eat in a heart-healthy way that supports your vessels. And if you smoke, know that nothing narrows and damages your small blood vessels quite like smoking. Quitting is one of the greatest gifts you can give your circulation. The principles are simple. Keep moving, keep warm, stay hydrated, and care for your heart and vessels. Small, steady habits genuinely improve how well your blood reaches every corner of your body. But before making big changes, especially if you have health concerns, check with your doctor first, which brings us to one final sensible point. So here's the safe, sensible guidance. This test is for gentle awareness only. It is not a medical diagnosis, and it's easily fooled by cold and by age. But do talk to your doctor if you notice genuine, ongoing signs of poor circulation, not from one fingernail test, but a real pattern. For example, hands or feet that are often cold, numb, tingling, or changing color. Nail beds that look persistently pale or bluish. Sores on your feet or toes that are slow to heal. Or leg pain that comes on when you walk and eases when you rest. That particular pattern is worth prompt attention. And seek urgent help right away if your lips or face turn bluish along with trouble breathing, as that's an emergency. For everything else, this is simply a fun, harmless way to build a little more awareness of your own body. Your doctor can always do proper testing if anything seems off. So there it is, a gentle press on your fingernail and the quiet return of color, offering a tiny glimpse into the flow of life running all the way to your fingertips. And the deeper lesson is genuinely uplifting. Your circulation isn't something fixed and out of your hands. Every time you move, walk, stay warm, and care for your body, you're helping your blood reach every corner of you a little better. Awareness is the first gift, and action is the second. You have real power to keep that flow strong for years to come. So try the test the right way, with warm hands and a calm mind. Take your result as gentle awareness, never judgment. Keep moving, keep warm, and check with your doctor whenever something seems off. If this helped or interested you, share it with someone you'd love to keep healthy and strong for a very long time. Take care of yourself, and I'll see you in the next one.